Yeah, good morning, everyone. My name is Aayushi. I have completed my graduation as a bachelor in dentistry, dental surgery, and I am also now pursuing MBA in healthcare management from Bruton University. I would also like to thank our healthcare professionals and our scientific supervisors present in our meeting today. That despite of these pandemic situations, they guided us with our research. So I would like to start with my presentation. My topic for research is evaluation of pharmacogenomic testing awareness, status of common people and healthcare professionals in India and Russia. So my scientific advisor is Dr. Cislina Svetlana Nikolaevna and a research consultant, Dr. Savosina Aleksandrovna. Thank you so much to these my scientific advisors. They helped me and guided me a lot. So these all contents we will be covering in this presentation: introduction, objective, location, materials and methods, literature review, responses of the survey, and my work plan for May and June. So, what is you might be aware that what is pharmacogenomics? It is basically a study of the role of genome in drug response. Pharmacogenomic basically analyzes the genetic makeup of an individual and which affects his or her response to the drugs. And with this, it deals with the influence of the acquired and inherited genetic variation on the drug response. So basically, it involves both pharmacokinetics and pharmacodynamics. And likewise, design therapies based on the individual's genome, subtle but important differences in genome, then identify how different people respond to different drugs, and identify those who suffer harmful side effects from the particular drugs. Then, in short, we can say that pharmacogenomics, with the help of pharmacogenomics, we can identify the right drug with the right dosage and for the right patient. For example, in this picture, uh, this is a whole patient group in the center and with the same diagnosis and same prescription. I would like to show you that how these patient groups are affected with the same kind of prescription. When we look at the red group, the drug is toxic but not beneficial. So they will suffer side effects and which is potentially harmful for them in future. Then if we go to the blue one, drug is not toxic and beneficial. So this is the only group which is benefited without the harmful effects of the drug. Then, if we go to the yellow one, drug is not effective and not beneficial also. So, they're taking the drug or not taking the drug, it's the same for this group of people. Then, if we go to the green one, drug is toxic but beneficial. They will have ill effects, but the drug is beneficial. So, only one patient group is benefited by it, and rest of all are taking this in vain. So, what is the evolution towards? As I was looking for the data, done literature review, I've come across this evolution towards the clinical practice. Pharmacogenomics was first recognized by Pythagoras around 510 BC when he made a connection between the fava bean ingestion with hemolytic anemia and oxidative stress, the dangers of it, and the identification was later validated and attributed to deficiency of glucose 6 phosphate deficiency, which is called as favism. Uh, Here in the diagram is the timeline of the discoveries in the field of genomes. Starting with the 1953, the invention, the identification of the double helical structure of the DNA. Then coming towards the 2011, that was the 1000 Genome Project. So I would like to also involve in this that why it is related to healthcare management, why it is important for the healthcare industry. Benefits of it in the benefits of pharmacogenomic, as we can, sorry, yeah. So it improves the drug safety and reduce the adverse drug reactions. Then it improves drug discovery targeted to human disease, improvement and efficacy and the patient compliance, and also to develop more powerful and safer vaccines. So basically, when pharmacogenomics will be adopted, uh, it will it will be effective drug development, safer drug with enhanced potency, better selection of drugs, better vaccines, powerful and safer vaccines will be invented. And in short, it will lead to better patient care. So my objective for this research is evaluation of the pharmacogenomic testing awareness status among the common people and healthcare professionals in India and Russia. Goal one would be to know the awareness and attitude of the common people of both the countries, and goal two to know the awareness and attitude of the healthcare professionals of India and Russia. So I would like to inform you all that I was not able to collect much of a data for healthcare professionals, as due to this pandemic situation, uh, all the professionals were busy. I was able to collect data from the common people from both the countries. So the materials and methods. Starting with the method, the research paper is exploratory in nature, and basic objective of this study is to understand the awareness level of the people, and for which I prepared two survey questionnaires for both common people and healthcare professionals using Google Forms and Microsoft Forms. Me and my research consultant, Dr. Aleksandra, she helped me a lot as she translated my questionnaire into the Russian language, and she shared with the Russian population, and that were circulated randomly among the masses here in Russia and in India. And because of the COVID-19, I've already mentioned that I was not able to collect. So for next 1 month, I will try my best to collect the data from the healthcare professionals. So the materials that I used, the PubMed, then the Google Scholar e-library, which is the Russian electronic library for scientific publications. This is a small view of my literature review, uh, just to show you that these are the things I've explored. These are the responses of the survey from both India and Russia. The yellow one, the brown one is for the Russia, and blue one is for Indian population. I've collected around 98 survey subjects. These are the researchers. I would combine it this in this month, by the end of this month, combine the results. And my work plan for May and June is to collect the data from healthcare professional. If the situation will get better, then combining research results and research analysis, more of literature review, prepare final draft of the diploma paper, final review of the scientific supervisor, and submission of the research paper to the university. Thank you for your attention. Do we have any questions?
Ayushi, thank you very much. And I want to tell you that you are a very good student, and it was nice to work with you in March and April. And I hope for our productive cooperation in May and June. Thank you. Good job.